things started to come home to people in terms of, you know, seeing some of the cuts actually happen to them, because it wasn't just budget cuts to hospitals and stuff. I mean, there were items were de-insured. Senior citizens in particular started to feel the changes that were happening on the long-term care side, senior citizens and their families. So I think it was, as we, you know, things it was easier to mobilize people as more and more people and those branching out for them were affected. We also had some, we were fortuitous as well in terms of how blatant the attack was sometimes on healthcare and the attempts to diminish people who were involved in it. I mean, one of the best things from my perspective that Ralph Klein did was to call us all left-wing nuts, right? Because it did two things. It also said to people who were legitimately concerned about healthcare, regardless of what political stripe they were, that being concerned about it made them somehow nutsy. But it also gave us an incredible mobilizing tool in terms of a symbol. And we went and bought the left-wing nuts and put a ribbon on it and sold it, right, and raised money for the campaigns. But that actually did help. I don't think he would have ever said it if he thought it would have helped, but it did.
So you've outlined a few places where, you know, we've really been hurt by the forces of evil, by the dark side. You know, you mentioned that we actually lost the battle when it came to long-term care. Mm-hmm. We've won battles. When have we won? Name a few of the victories that Friends of Medicare could wear like a decoration. Eh?
Well, I think the ultimate legislation, what became the Health Care Protection Act, which was the Bill 37 to Bill 11 became the Health Care Protection Act, is nowhere near what the corporation profiteers would have hoped to achieve in terms of private facilities and that kind of stuff. So I think we had some significant wins around Bill 11. I do think that I think Ralph blinked big time. We didn't get everything we wanted, but if you look back at where that whole debate started from, I think we made huge things. And the cataract surgeries, we got the facility fees covered. I mean, that was very much thanks to Zian Marleau and all the work we did with, because we did at the federal level during those years. We were very actively engaged with the federal Minister of Health and campaigns. I mean, we got just the paraphernalia I've kept from over the years. You know, we were successful in getting a Royal Commission on Healthcare. We were.
The Romano Commission.
We got that.
Okay.
That started with and I'll always remember Richard Plain saying, we need a federal commission akin to the Hall Commission on healthcare. And so we had the first postcard campaign on that. Kim Campbell was Prime Minister, and the postcard goes to Kim Campbell, actually, calling for a Royal Commission for Kim Campbell. But, I mean, I think we should take credit for there even being a Romano Commission, which through those years, actually, I think was helpful in pushing back against some of the tides that of privatization that would have gotten farther. I think we should consider the most recent budget a success in terms of advocacy working and community advocacy and collective work. So Bill 11, the Royal Commission, what else would I say? We're not done yet. Those are some of the ones so far. We're not done yet.
Let's go back to the dark side just for a moment, because we do have that experiment. We have a laboratory now. It's called long-term care. When you want to tell people what's wrong with the third way, with a P3 third way, what would you say about what's happening in long-term care to substantiate your point? What's so bad about that in long-term care?
Well, long-term care epitomizes you pay more and you get less. It's
just develop that a little bit.
It's a la carte care. It's a la carte services for seniors, where instead of providing an encompassing environment, living facility and care facility, we say basically consider this a hotel. And so you pay for your hotel room, you pay for the food you eat, and in this hotel room, if you want or need nursing care, well, you're going to pay for that too. So it's the unbundling and piecemealing out of services, and we call it a duplicitously enticing phrase. We call it assisted living. Isn't that so much better than a nursing home? You're going to be in an assisted living. What it really is assisted dying or assisted pickpocketing, because until you have no resources left, you can stay there, but let's face it, then you are subject to whatever minimal requirements society hands out to the poor, right? It's what we have done in long-term care is we have said getting services and the quality of services and the level of services is really based on your ability to pay.
Okay.
And we've started that unbundling on the acute care side as well. Because if you look back at when we first got Medicare and it was to cover all physician and hospital services, things like rehab, recuperation and rehab went on inside hospitals. What we now have, by and large, is a system where rehab is outside hospitals, and if you need or want rehab, basically you better have private insurance or be able to pay for it. So we've pulled things out of the bundle, what we used to know as a hospital bundle, and passed it on to individuals to either pay for out of pocket or cover with insurance.